When the U.S. Supreme Court upheld the Patient Protection and Affordable Care Act, it gave states the option of accepting federal seed money to expand Medicaid to include more poor people. 9 Republican governors have indicated they may reject the Medicaid expansion. Critics claim that possible rejection is partisan politics aimed at scrapping a plan by a Democratic president. The federal government will cover 100% of the cost the first 3 years, then reduce its share to 90%. The governors say the expansion will be too costly for their states when the federal money is reduced. Medicaid expansion in those 9 states alone could bring health care coverage to as many as 5 million additional people.
So many of the state Catholic conferences are starting to look at that and how they can be advocates in their own states to encourage the legislatures there and the governors to take advantage of the Medicaid expansion so that more people have access to health care. The bishops are looking at this really from the moral perspective of health care being a basic human right for everyone. However, there are some policy issues around this that make it advantageous for states to really consider taking that Medicaid expansion option. And one of those is that in the Affordable Care Act, one of the things that was used as a to pay for the health care reform was an elimination of the disproportionate share payments to hospitals that serve the neediest. Many of those hospitals are Catholic hospitals because they go into communities where there is underserved and a lot of uninsured people. Those were agreed to be taken away by the hospitals because they knew that there would be broader coverage so that more people would have it. So you wouldn't have that much uncompensated care. So there is no federal funding now for uncompensated care. So if the states don't take that Medicaid option, then they're going to have to find ways locally or at the state level to help pay for the uncompensated care. And if it's not done through the state or local level, it's going to get passed on to patients who do have coverage.
In Washington, this is Chaz Muth for Catholic News Service.